One of the things quite common in patients that I see in my fertility practice are patients who have painful periods and turn out to have endometriosis. Endometriosis being a disease where the inner lining of the uterus is basically at the wrong side and in the pelvis might actually cause scarring and inflammation in the abdomen that can damage the tubes, sometimes to the point where they even can get blocked, or basically there is damage at the end of the tube. The other thing that is, I think, a major thing that all our viewers should know is infection. And I think infection is, in some patients, you see can cause a lot of damage. And unfortunately, the infection might be a long time before the patient presents to my office. So even if somebody had, for example, chlamydia infection in their 20s, they might present to me at age 35 wondering why they're not getting pregnant, and then if we do the history, if we, for example, even can check chlamydia antibodies to see if the infection really was present, we might be able to find out that that is the reason why the patient is not getting pregnant. Now, we do not have always a fix for damaged tubes, but the good thing is that with today's technology, we can get a patient pregnant even without using the fallopian tubes, or the fallopian tubes being blocked or even removed. And once the embryo is formed in the tube, the embryo goes back to the uterus, and in the uterus, that's where it has to implant and grow. And then in some patients we have problems in the uterus that the environment is not friendly, and it's a more hostile environment with polyps or fibroids. And in those cases, we actually have to address the problem in the uterus before we even move on with getting the patient pregnant.